You are watching McLaren Port Huron Today's Health Program, and I'm speaking with Dr. Zubin Bhesania, a board-certified general surgeon, about GERD. So, Dr. Bhesania, so what exactly is GERD?
GERD stands for gastroesophageal reflux disease. It's a very, very common problem. Most people refer to it as just heartburn. It affects millions of people each year.
And so some people may just say reflux instead of GERD too.
Yeah, so GERD, heartburn, reflux, indigestion, all sort of encompass the same problem.
So can you tell us what causes GERD?
So GERD's a problem where the valve at the very top of the stomach or the bottom of the esophagus, called the lower esophageal sphincter, is not working properly. So that valve's job is to keep the contents of the stomach within the stomach. So when that valve doesn't work properly, gastric contents comes up into the esophagus, and the esophagus is not designed to handle gastric contents, okay? So the stomach has acid, which is used for digestion. So that liquid that comes up into the esophagus causes a chemical burn. And that's why it's called heartburn, because it actually burns the esophagus and irritates it. And that's what people complain about when they're having heartburn. There's actually irritation of the esophagus that is occurring because that valve's not working properly.
So in addition to heartburn, are there other symptoms that people may experience?
So sure, so we complain about heartburn as our first symptom, but there's other symptoms that people don't think about. So we have people with a night cough, for example. When they lay down at night, they'll start coughing, and that's because that liquid is coming up to the top of their throat, actually, and they're having a little bit of aspiration when they breathe at night, and that creates a cough. We have pneumonias that occur from reflux. We have people with breathing problems, so certain things like asthma occur from reflux. So it's not just heartburn, but there's issues that can happen with that. Also, as time goes on, if the esophagus is significantly irritated, we can have issues with swallowing. That's called dysphagia, where they'll have trouble swallowing or feel like food's getting stuck there.
Do people maybe have like more frequent hiccups or anything like that, or is
Typically not hiccups, but they will complain they have some discomfort eating, they have a tickle in their throat, they'll have a night cough, and they'll feel, they may taste acid or bile when they bend over to tie their shoes or pick something up. Those are all very common problems with more severe GERD. But most of the time, most people complain of some pain that's sort of behind their breastbone, indigestion, burning sensation. Typically, when we find these patients, we'll do some workup of the patients, and a lot of people have an issue with a hiatal hernia, which means there's basically a hole in the diaphragm where the esophagus travels through. That hole enlarges, and the stomach will slide up into the chest just slightly, just a few centimeters. And when that happens, that valve, called the lower esophageal sphincter, won't work properly because it needs the muscles of the diaphragm in order for it to work.
So are there risks for people that don't have GERD or reflux treated?
So long-term reflux will lead to damage of the esophagus, and that will lead to something called Barrett's esophagus. So what happens is the lining of the esophagus is not equipped to handle acid contents, so that chronic acid inflammation will change the lining of the esophagus, and that's called Barrett's esophagus. And over time, the cell type can change, and that can lead into esophageal cancer. But we're talking many, many years of untreated reflux. But thankfully, nowadays, most people who complain about it will get treated.
Mm-hmm. And how do you usually diagnose any issues with GERD?
So typically people will see their primary care doctor, they'll see their gastroenterologist, they'll see their pulmonologist, and they'll make a diagnosis of GERD. So to diagnose it, what we need to do is do an endoscopy, and what we'll do is have a small telescope go down your throat into your esophagus and stomach. We'll actually do a biopsy of the tissue of the esophagus and send it to the lab, and it'll get checked, and we can actually see inflammation on that. There's other things we'll see. If we see a large hiatal hernia, we can see that easily on the scope. We can see inflammation in the esophagus. There's irritations that look like these little red linear lines on the lower part of the esophagus. We can see that during the scope. Also, there's x-rays that can help define GERD and heartburn and hiatal hernias. So something called an esophagram with an upper GI, where the patient drinks a barium contrast drink, and we'll watch it go down, and we'll actually see it go in the stomach, and we actually see it reflux up and down the esophagus.
So what are some of the treatment options for people that have GERD?
So typically people will take medications first, and medications are very common. There's billions of dollars spent each year on treating GERD. There's two classes of medications that are mainly used. We have the proton pump inhibitors, and then we have the H2 blockers. So there are a lot of people on medications, and the medications typically work well, but we've learned that there are some side effects over time from some of the medications, and now the FDA recommends that you should only be on the medication for a certain amount of time, take a vacation from the medication, and then resume it. Shouldn't be on it all the time because it creates problems. So we have issues with decreased acid is what the medication's doing, is decreasing acid, but that decrease in acid creates a decrease in absorption of calcium, magnesium, and so that creates osteoporosis, increased risk of hip fracture. There's some issues with dementia and possibly pneumonias with long-term use of these medications. So nowadays it's 12 weeks on and then 4 weeks off on the medication. You cycle it. Some people find that the medications work well. Some people do not find they completely solve the problem because the medication isn't stopping the reflux. It's only stopping acid production so it doesn't burn as much. So some people opt to get off the medication, and there's procedures we do to help people with reflux that want to stop reflux and not take medications.
And so are there other treatment options you had mentioned, like for hiatal hernia, for example?
Well, I'll back it up. There's some lifestyle changes that we do first, okay? So obesity creates reflux. Avoid eating or drinking really late at night. Sometimes people raise the head of their bed up to help change the angle so they're not totally flat. But those are difficult to do for like the rest of your life, right? So then if people have a problem with reflux, some people opt to go to surgery to fix it.
Yeah, so tell us about what the surgical options are.
So typically surgery is done laparoscopically nowadays for this. The operation is fairly straightforward. It involves 5 little skin incisions. The incisions are about 5 millimeters each. We're able to find the hernia. We reduce the hernia back into the abdominal cavity, so we pull the stomach back down from the chest, back into the abdomen where it belongs. We then tighten the muscles of the diaphragm that created the hernia, and then we actually do a small little wrap of the stomach around the bottom of the esophagus to create a high pressure zone. So the operation takes about 35-40 minutes. It's well tolerated. Most people will have a little bit of shoulder pain from the gas from the laparoscopy. That goes away. Most people go home the next day, so they have surgery and they spend one night here and go home the next day. We do an x-ray after surgery to make sure everything's open and that they can drink fine. Sometimes people have some swelling initially and they'll feel like food's slow to go down, but that typically resolves over the first week or two.
Very good. This has been really great information. Do you have any other closing comments?
No, so I mean, if you have heartburn, you really should have it treated somehow, whether it's medications. Usually that's the first line treatment, but if it's not working well, there's a surgical option.
Great. Thank you so much for this information.
Thanks.
And thank you for watching McLaren Port Huron Today's Health Program. If you found this video helpful, please be sure to like it and share it on your social channels. You can check out the entire video library at www.mclaren.org/phvideo.